where I started to see all of these, and let's call them what they are. They're, in most cases, even if they're MDs, they're not practicing medicine. They're influencers. Somebody called Joe Rogan the goop for men.
Oh.
And I thought that was hysterical, even with psychedelics, right? They're these consciousness expanders, right? So people are paying top dollar to go to these retreats, high-end CEOs and really wealthy people, and they come back and they're still pricks.
Yeah.
You know, and it's like, well, you did the thing, but you didn't do the work. You didn't do the integration.
Before we dive in, I want to take a moment to tell you about why this podcast exists and where it lives. The Great Connect is part of something much bigger, the Holistic Health Hub, a first-of-its-kind platform bringing together practitioners, products, creators, farmers, and more into one place. Because finding real, trustworthy wellness support shouldn't feel like a scavenger hunt. The hub is live. It's free to explore, and it's growing every single day. You can browse the directory, bookmark what resonates, and build your own personalized health hub, a curated collection of the resources that actually make sense for your life. This podcast is the conversation that brings it all to life with those practitioners. And the hub is where you take what you hear and make it yours. Visit holistichealthhub.app and come find what you didn't know you were looking for. Now to this next amazing conversation.
Well, if the energy isn't already high in this space, based on our pre-conversation, I look forward to where we're going from here. So thank you for joining me today.
I was like, I'm going to get on and within 5 seconds, I'm going to know whether or not this is going to be a fun time. And like, I was like, oh, she's smiling. We're going to have a good time.
Yes, absolutely. This is going to be a good conversation. And I'm going to kick us off by saying, okay, the word that all health folks hate and yet is what's bringing more people into health.
Yeah.
Biohacking.
You know, wow, you're teeing it up. Let's get me all angry right off the get-go. So look, I was huge into this word. I really leaned heavily into it. My clinic, when I opened it in 2016, that word, Dave Asprey takes credit for that. Now he's, getting facelifts and stuff, because like that's how you optimize yourself. So anyway, but it was great in its intention. How do I make my environment? How do I make myself as healthy as I can be to be resistant, live longer, have a better life, all of those things, right? That everybody wants that, right? That and most Americans want to get a pill that does that. So biohacking quickly became kind of a word that I like to make fun of because look, you want to talk about optimizing yourself. Yeah. We're like, I don't want to say pack animals, but we're communal animals. I mean, we're greater primates. Mm-hmm. And we have a society and we need to be part of that society or we get sick and die very easily. Being banished in tribal cultures gets you dead within a month, right? So what we should be doing is saying, who are the most marginalized? Who are the most sick? Yeah. How do we take the best care of them? Why? It's very selfish. If the person that I'm standing in line with is coughing up a lung, I could get sick. Mm-hmm. If that person has great health care, they're not under stress, they have a living wage, they have a house, they have clean running water, I have a better life too.
Yeah.
Right. So, say you should be humane and care about other people. Right. That should be like, I can't fix that for you if you're not.
Yeah.
But within that, there's also a selfish component. Yeah. Look, it doesn't hurt me if everyone's walking around with a PhD, right? Right. And I'm not saying everyone has to get a PhD. Don't if you don't want to. But the better educated society is, the better it is for me. Yeah. So like, look, these things shouldn't be so political and they should be like well, we all do better when we're all doing better, right? I mean, that kind of almost means nothing, but I said it.
I fundamentally agree with you because part of my passion comes from. I really believe how we change the world is no longer an external effort, it's an internal,
Mhm.
right? And if you do the work on yourself,
Yeah.
be a better human, a better person, happier, less stressed, whatever those things are for you, and everybody's unique, that translates into like,
Yeah.
if everybody's doing it, it's just everybody's getting happier, healthier, better, stable, calmer, maybe is just the best of all of
Yeah.
it.
Yeah.
And
Yeah.
that's how you change everything, in my opinion. Like,
Absolutely, absolutely.
yeah.
Even with psychedelics, right? There these consciousness expanders, right? So people are paying top dollar to go to these retreats, high end CEOs and really wealthy people, and they come back and they're still pricks.
Yeah.
You know, and it's like, well, you did the thing, but you didn't do the work. You didn't do the integration. You didn't do the you were there to check a box because every other rich bastard did it.
Yeah.
You weren't there to
right.
yeah,
right?
yeah. Like, oh, look, I did that thing, right? I own the jet. I own this. I did the psychedelics. Look, I've been there. No, you haven't looked at the dark parts of yourself and you haven't been willing to make the shift. So you never will.
Yeah. Yeah. 100%. Right. Yeah. It's about checking the box rather than like intentionally wanting to move through whatever is there
Yeah.
for you.
Yeah. I mean, we see this with patients sometimes. It's not so much the modality they choose. They're stuck where they're at, right? And if I can't get them to shift that, I'm not going to help them either. And they've already told me they've been to 50 other practices and modalities, and we've tried everything and nothing's working.
Yeah.
And yeah, maybe it's my skill. Maybe I just can't hit them. But like, maybe there's a shift that like you're just not willing to make.
Yeah. 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 100%. I like to say that the most controversial words that I say are you choose.
Mhm.
You choose the experience, like whatever you're like doing, like you're choosing that right now. And
Okay.
choosing not to be healthy or improve yourself or whatever that is, right? Like that patient is like ultimately asking somebody to fix them. They're not
Mhm.
choosing to fix themselves, right? And so that's fundamentally like you can't help that person.
Yeah. 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 Yeah.
It's
You
not
know,
in
like,
themselves.
and you'll see it in all aspects of life too. It's not just even just healthcare, right?
Yeah.
Well, okay, go do this.
Yeah.
All right, I didn't do it. Okay. What okay, so nothing changes, right? No, nothing changes.
Yeah, exactly. Right. Like you are ultimately in control. And that's why I find it so controversial when somebody says something. I had a friend say something and she's like, I'm getting older and I don't want to feel like this. All right. I said, okay, so then say don't. And she's like, what?
Yeah.
Like, well, just choose that you don't want to and then don't.
Yeah, yeah.
And I know that sounds simpler than it really is, right? But it's a mindset shift of like, am I going to do the thing because I want to, or because I'm checking the box, or this person's just going to fix me? Like I don't have any control. And I think it's about owning that.
Yeah, yeah, yeah. And I think as a society, there is this you know, and certainly there's always external factors. I'm not saying you know that like stuff doesn't happen to you. Yes, stuff happens to you that like you were definitely not planning on, not intending. But within that, you do the best to play the cards you have, and when you reach out to get help,
Yeah.
you know, one, make sure you vet the person that's helping you, and then two, if they offer you something and you take it or you don't take it, that's your choice too, you know?
Yeah, that's what I mean. Like, okay, this thing has happened. Now I get to choose what to do with it. I can wallow in it. I can let it
Yeah,
overcome
yeah.
me, or I can choose, hey, this is opening something that I've never
Yeah.
seen before. I'm going to choose to move through it. And so many people, I don't think, see that as an option.
Well, look, you know,
Yeah.
fall apart, cry, have a fit,
Me
do
too.
it,
Yeah.
process it. But when you're done with that,
Yeah.
now, okay, no, you're right. This sucks. Shouldn't have happened. Sorry it did.
Yes.
Feel bad, right? The Chinese have an expression that externally sounds really mean. Mourn well and get over it. right? And they're not saying stuff it away and get cancer 10 years down the road.
Nope.
They're not saying develop a personality disorder over this. They're saying, look, if you're sad, let it out, feel it as much as you can. And then when you can,
Yeah.
get going. Yeah.
Right. Because if you really, really lean into that, it moves
Yeah.
through your body. You're an ocean, right? Like let it ripple through and you will feel it clear. And then
Yeah. Yeah.
well,
I did not realize I was announcing my career as a mindset coach on this show. Nowhere in my specialty is anything I've said so far.
well, I mean, I think so much of it comes down to that, right? That it is part of that. But I love that. Yes, new career for you. Just
Why not? We'll just add another line on the CV.
Okay, so maybe that's new to the CV. Tell us a little bit more about what's already on the CV.
What is old? It's so old. It's roughly 3,000 years. No, I've been a licensed acupuncturist, a doctor of acupuncture, and Chinese medicine is the title. I say East Asian medicine because I actually practice Japanese style acupuncture for over a quarter century now. So the official 25-year mark of me being licensed is April 29th this year. But, we had clinical internships for about a year and a half, 2 years before that. Maybe I'm including some of that. But it has benefited my life. Hopefully I've benefited other people's lives with it. And it's one of these careers that is not easy.
Yeah.
It is very meaningful, and I feel the people that are in it like me, I'm going to call myself a lifer now. It's not a job. It's not something you put on the scrubs and you go to work and you take it off. It invades every aspect of your life, and the more you surrender to it, the more you get out of it. And I fortunately had a mentor that did all the hard things for me. He lived in China for 12 years, Japan for 10, traveled all over Asia and studied with everybody all over the world, and then brought it back to me on a platter.
Oh.
I'm mentioning him because he passed away a few years ago, and there is this Japanese word that they tend to use a lot in martial arts when they're referring to their teachers, and it's called giri, and it means like a debt you can't repay. Now I'm going to jump to Chinese and say there's an expression: when drinking water, remember the source. And here's a British guy teaching another white but American guy East Asian medicine, and he was always quoting his teachers. And he said, look, we can do this, and we can do this in a way that we're not appropriating, but you have to remember what came before you to the best of your abilities, because we're going back several thousand years, and there's a lot of gaps. We don't know who this guy was. He's mentioned in 4 different texts. We don't have that text. And there's some great stories that arose from it to kind of make people's experience like almost on this godly level, even though we know like, no, that couldn't have happened. But that's the story that goes with that guy. He did a double heart transplant. When? About 1,500 years ago. I don't think that happened. No, but he was just a really good surgeon, stuff like that. So you get this baked in kind of tall tales. You get this baked in mysticism. You get plenty of spirituality that's not necessarily tied to one single religion. And you talk about every aspect of human life, not just what people are doing while I'm putting needles in them.
Yeah. Yeah. I mean, to me, that's just like, that's it. Like that's health, right? Is that it is comprehensive. It's ancient. It's new. It's for our daily lives today. It's every piece and component of your life and your body and what you can't see in your body and what you can't see outside of your body, right? That there's just so much to connect, and love how you said that. That's really beautiful.
Yeah.
So as a lifer, and I would offer you're probably having a good impact if you're a lifer.
we're trying. The average burnout for my field is about 5 years, and that's really sad.
Wow.
And some of it is, look, it's an alternative field, so alternative people go into it, and you go to make an appointment and they're like, I don't know, when do you want to come back? And it's like, well, you're the practitioner, maybe you should be guiding that part, or like, I don't work on Tuesdays too often, but if you show up I might be here. Like, well, you can't run a practice like that, right? Not when people so ones of us that really continue to learn, and the ones of us that really are looking at this as we're polishing a jewel, and we're constantly trying to get that jewel shinier and better. And even when we mess up, right? My mentor used to say this: you're going to remember the people that you couldn't help more than the ones you could. And he was right about a lot of things. That one stings still.
Yeah.
Like when you do something that knock on wood, I've never hurt anybody or anything, but when you can't help somebody and they're really suffering, you try and keep that professional barrier. Actually referring to the Chinese organs now, right? The heart envelope, the pericardium, is supposed to protect you from that, right? Literally, it's called Baoxin, heart wrapper. Heart envelope is what it called. A bao, and I'm doing this because bao also means hug. It's the character's two arms, right?
Yeah.
But it's this protector for your inner core, for so the heart is the emperor in Chinese medicine. So sometimes they'll refer to the pericardium as the ambassador or the envoy. So you don't get to talk to the emperor. You go through the pericardium. Pericardium decides whether or not you're going to get your message through. Yeah. But when something cuts through you like that, it's normally somebody I can't help, or just that like something really tragic that you hear in the treatment room. I've had to walk out in 25 years 3 times to cry. And I don't want to tell you, because then no one will want to listen to the show, and then I'll feel bad.
We're gonna leave that.
We'll leave that one. We'll leave that one. Yeah.
Over there, but I mean, it happens, and as much as you want that number to be 0, for it to be 3 is still monumental. When I feel like we live in I never know what word to use, because traditional, modern, none of those words seem to fit.
Less and less as time marches on too, right?
Until I'm like, I don't know. I don't think that any of those words fit the existing system, but how many of them have 3 or 0?
Well, you don't know, and fortunately, given what I do in the area I'm located in, I get a lot of Western practitioners too. Right. So they're coming in, and unfortunately, sometimes it's more of a collegiate discussion than just an acupuncture treatment when they're on the table. Yeah. And they tell you the horror stories. Right. So I think a lot of people, when they're saying, oh, the medical system is flawed, they're wrongly putting that on the practitioners, and the practitioners are just pawns in it too. And when they see a failure because somebody doesn't have insurance benefits and they got to kick them to the curb or something like that, that hurts them. I mean, they don't like that. That is not to say a gun to your head, but that is like, get them out of here or you're fired.
Yeah.
Right. And it's rough, because we're in this kind of crazy, tumultuous time where, burnout for practitioners is so high, and so many people that have invested so much time, money, and mental anguish to become certified, licensed, whether it's an MD all the way down to whatever, are just like, I don't want to do it anymore.
Yeah. Yeah. People that I'm sure grew up with this strong desire to help people, to make people feel well, to be able to support people, probably, so many stories. And to your point, so many years and hours and, energy poured into this desire to support and help, and then to almost be handcuffed in a system that doesn't allow for that to happen is devastating to me. That it really is a amorphous blob that is the system. It is not the people, because I think the people ultimately want the best.
Yeah. Yeah. It's funny because George Carlin, and I forgot what show he was on. He was on some panel.
Yeah.
And somebody said, of course, George, you can't think there's some great cabal of these, evil, wealthy people, wrenching their hands, deciding how they're going to screw people over. And George Carlin very quickly pointed out, like, it doesn't even have to be that, right? Somebody's seeing a way to make money, and then another person sees this from a different angle, and here's how I'm going to exploit that. Next thing you know, the whole thing's corrupt.
Yeah.
And he wasn't necessarily just referring, I think he was referring to politics as a
Yeah.
whole,
Yeah.
but this is what happens when we're making capitalistic decisions on people's lives.
Yes.
On the actual health and wellness of them.
Yeah.
There's so many people, fortunately, carrying the torch for this right now, that I hope very soon we're going to see some big changes. And for whatever little part I can be of that, I would love that too.
Yeah, I mean, that's certainly my passion. I kind of refer to it as, right, because I really believe fundamentally, even though maybe I could be proven wrong time and again, but it's fundamentally everybody's trying to make good decisions for whatever their situation is, but we've created like a leaning tower of Pisa, right? This decision got made this way, and then another one on top of it got made this way, and right, and maybe each one of those decisions wasn't the worst decision with an intention to tear it all down. But when you start stacking each of those decisions on top of each other, you start to build this out of whack, no longer grounded and centered. And now it's just collapsed. We propped it up so many times. We've got duct tape. We've got all the rigs set up. But honestly, it can't sustain anymore. And unfortunately, that's a really challenging moment we're living in. And you yourself, as well as so many of us, are impacted by the fallout of that. But I also believe there's an opportunity then to create the new from that experience.
We're living in a time of constant updates where headlines travel instantly and the whole world fits in the palm of your hand. But long before the news cycle and social media, humans gathered around a fire to tell stories, to make meaning out of chaos and find each other in hard times. Mead Hall Mondays brings that tradition back. Beginning in March, every other Monday, Ben Emery hosts a free virtual gathering blending powerful, true storytelling with small group practice in peacemaking and courage. No sides to pick, just story, imagination, and human connection. Find the link in the show notes.
And look, people will argue what system replaces it, right? So there's an ER doc named Terry Mulligan here. I'm going to give him a little shout out at University of Maryland. He is part of this movie that my podcast is actually hosting on March 19th of this year. And he came on, and he's been setting up emergency departments around the world in countries that don't even have them yet. And he said with all of his travels and all of his knowledge, he went back. And of course, because he's an MD, and apparently he wasn't good enough as just an MD. So he has a degree in public health as well. He said there's about 7 or 8, depending on how you slice it, different healthcare systems. And it's everything from fully covered by the government to some hybrid where the insurance companies bid from the government, and then you get to select a private insurance company with, from the list, and the government pays for it. And then this one.
Yeah.
And guess which one is the most expensive, has the worst outcomes, and, is really just lining the pockets of a very select few, right? And, I was kind of rallying against like big hospital systems, right? Like, oh my God, this is the only hospital system in the state, and if they decide not to take your insurance, you're kind of screwed.
Yeah.
Right. And he goes, yeah, that's bad. But just so you know, the biggest hospital system has about a 3% profit margin, where every insurance company, after all the crazy bonuses, after the CEO makes his 20 million, 30 million, 90 million a year, 40% profit.
Wow.
So why when we have AI, right?
Yeah.
Why when we have, you're laying off people at record speeds,
Wow.
and you could do this all with a machine that could be, if it was handled correctly, unbiased, more on evidence than
You're a dreamer, Tom. I didn't.
Well, look, all the tools are there,
I know.
but who is wielding them is the problem. And look, oh my God, the doctors. And I'm like, no, I know doctors that are freaking bankrupt.
Yeah.
You know why? Because you gave them a $500,000 student loan debt.
Yeah.
And then they're paying $300,000 to $500,000 for malpractice every year, depending on their specialty.
And they're likely paying for their own health because they're being destroyed through burnout and stress because the system makes them do things in a way that is misaligned to their values, right? Like I heard, so my mom had a pretty big health challenge last year. She had open heart surgery and has had a lot of different things in and around that and all of this. And, to have the nurse say, well, yeah, she's sitting in the waiting room because we have to do X number of reds, X number of yellows, and X number of greens every hour. And that's just how it works. Otherwise you don't get paid, is like, what?
It wasn't, none of it was developed for patient benefit, unfortunately. And going back to Dr. Terry Mulligan again, he was saying, he pointed out this time in the 80s when healthcare was about the 7th largest market in the country. And a lot of those Wall Street, investors and everything said, well, here's something that would be easily exploitable. And it was parasitic, it was intentional, and now it is by far the biggest industry in the country. Maybe the military industrial complex is bigger, but we can rally against that too, because that kills a lot of people too. God, now I sound like a certain way, and I said I wasn't going to get political.
Also hard to stay away from. I get it.
but within that, right, these are not about how do we take care of other people, right? And then those are the same people with the giant cross around their neck. So like, sorry,
it's like,
now I'm getting religious.
Yeah, tick all the boxes, just tick all of them.
I mean, they become so intertwined that you almost can't, right? And you can now tell by how somebody refers to something, whether or not they tell you their opinion.
Yeah.
On which way they lean.
Yeah.
And that's very upsetting. Very upsetting.
Yeah. There's so many things collapsing all at the same time. And I hear that conversation about healthcare and insurance. And I'm like, well, who says that that's how we should be doing insurance? Like, when does insurance need to exist if we're healthy?
The thing that always upsets me is the statement, well, this is the way we've always done it.
Oh,
right?
That is like, literally, if you want me to do something, say that, and it is like sticking some like fire in my back.
Yeah. I was going to say I'm reaching in my pocket for a lighter and I'm going to burn the whole damn thing down. Right. And that's, and now here, I just said I practice a 3,000-year-old medicine, but like there is something to, if it works, don't try and fix it.
Yeah.
Or if it ain't broke, I believe, but
it's working, it's netting positive results. Whereas, like, how many times do we have to get hit over the head with something not working?
Well, how many times do you need to see it fail?
Yes.
Is even worse. And when we're dealing with people's lives, and even if they live, right now, they're just managing being ill.
Yes.
And what kind of a life is that for them?
Yes.
Right.
Yes.
It is infuriating. As a practitioner, it's infuriating as another human being.
100%. Like the words that I hear people say, such as, well, this is what it's like getting older. I'm like, no, you've accepted ill health as part of aging. And you've accepted that's not true and doesn't have to be true for you, but you have already accepted it. So
Absolutely.
therefore you're perpetuating that storyline for yourself and for all of us. And so I hear it, and it just like, oh, it really like it lights that fire for me, because that is just, no, that's what we need to change. It does not have to be like that.
Yeah. And, you know, there'll be people that'll argue that, no, that's not true. And what I would point out is they are probably in a certain income bracket, right? So on my podcast, Matt and I say a lot, we use this quote a lot. Now I'm blanking on who said it. But the future is here. It's just not evenly distributed.
Oh.
Right. So look, you know, you can get cutting edge treatments. Oh, yeah. Oh, we're doing some crazy stuff. Yes, you're absolutely right. How do you get it? Well, you give this guy $200,000.
Yeah.
Okay.
Yeah.
Guess who gets that? No one.
No. Yeah. Right. No, you're so right. You're so right. But also go back to what you do in the world, right? Which is something that is supportive and is preventative at the same time.
Yeah.
And so how much of it is reactivity versus proactivity around that?
So ideally, it would all be proactive. However, because we've been labeled alternative, because we've been labeled, you know, we're not the traditional ones, which I don't think that, like, that's what that word means. It's like, you know, it's like, well, we're not modern. No, like, you know, you're alternative. That word didn't exist for this that long ago, right? Yeah, you know, but ideally it's proactive. What ends up happening, and the hipper people are getting, you know, that's changed in the 25 years I've been practicing.
Okay.
Definitely more people are reaching to us going like, look, I could go and jump right to the MRI.
Yeah.
But let me see if this can take care of it first, right?
Yeah.
And certainly if we see red flags, I don't want you in my office because I don't have an MRI machine and I don't want you to get hurt. Yeah, you know, but within that, a lot of times the intervention can be quicker, easier, and hopefully enjoyable. I mean, you know, I say all the time, hey, you're not coming to a spa, but I do want you to be comfortable and relaxed while you're here. And with all of that, you know, I still have those people, and there will always be those people that I've tried everything else. Nothing's been able to help, and they come in, and, you know, hopefully at least 50% of the time we can show them something, and they see some improvement. You know, those people that are looking for the miracle are always the ones that I'm most worried about, because I don't, you know, I know a lot of weird stuff that some people might not have thought of, but a lot of times you get to me and you've checked off a lot of those boxes already. You know, and then the ones that really get it are my lifer patients, you know, the ones that have been seeing me I've been in Baltimore for, I want to say 20 years now. And I have some patients that have been with me well over 10 years, a core group of patients that I see with some regularity. You know, it's not every week. But it's, hey, you know, I know this season's bad for me. I might come in 3 or 4 times, or I'll see you once a month, or, you know, so that maintenance, that like, hey, look, it's much easier to course correct before you hit the iceberg.
Yes.
Yeah. You know.
Yes. Yeah. That feels like your new career in mindset shifting coaching, but is like, that's the shift that we are hopefully in the midst of making, but also need to make in the health way of not waiting until something's falling apart. And instead, how are we supporting ourselves every day or through seasons, and knowing our body and when it's speaking to us early versus screaming at us at the end.
I think, and I'm going to speak as a Gen Xer here, and I've had this conversation with other Gen Xers. A lot of us don't look or at least I don't think I look as old as I am. And I think there's a big part of us that we're looking at our boomer parents going, oh shit, that sucks. I don't want any of that. What do I have? Oh, okay. No gluten. All right. I'll give that a go. Even if it's BS.
Yeah.
Let's give it a go. Yeah, and
We're gonna try.
and I hate to say, but the millennials down, I think, are like, everything's so expensive, everything sucks. I have to outlast this. Like I feel like there's some, like, they don't have the "you're not going to break me" that the Gen Xers do, but they're like, this is really rough. Yeah. And everything's really rough. What can I do that's cheap? And this is the real thing, right? We started knocking biohackers off the get-go, and some of it is because it's like, well, I don't have $60,000 to buy that piece of equipment. Well, what can I do? Well, I can get salmon at Costco. Yeah. Okay, cool. I can do that. Yeah. And then look, I'm at least doing this one or two good evidence-based things that are time-tested for myself, not fads. Unfortunately, they're not sexy. You're not selling a cookbook going like, don't eat stupid stuff like that. Although I that might be the title of my third book. Please don't take that.
I got plenty of other good ones. That's not it.
But even Dan John, who was this world famous strength and fitness trainer, it trains a lot of Olympians, said, eat like an adult, and it's like, everybody loves chicken tenders.
Yeah.
But they're fried. You're right. They're amazing, but like, not all the time, man.
Yeah.
You're 40. Get a vegetable.
So based on that, I have a question for you, which our topic is wide and far, and I love this, which is I'm actually kind of curious as a zennial or elder millennial, right? That's like right on the edge. Some I'm Gen X, some I'm millennial, but I don't feel like I was taught what eating like an adult was supposed to be.
No.
I grew up with TV dinners.
Well, you disclosed that you were Midwest, and I was like, Illinois, Chicago, right? No, not Chicago. Okay. Okay.
St. Louis, but still in Illinois.
Well, but St. Louis is a city. So
I'm not from there.
Okay, outside. So I think this is a real big thing, and we've railed against so many other systems. In the 50s, and once again, I guess I'm just dumping on boomers because like they screwed my whole generation up, and we don't even get counted in things. They're like, I've seen graphs where they're like, boomers think this, millennials think this, and I'm like, wait, hold on, there's like 20 years that you just glossed over, and we're still pissed about that. Did some of us not come in when the street lights went on? Is that what happened? Have you not found them yet? The 11 p.m. Where's Your Children commercial? You weren't watching that one, But like so back during Boomer time, right? Post World War II, right? We saw this thing, and look. I'm going to say this, and I'm going to put on a caveat here. If you don't want to breastfeed, I'm not saying anything negative against that. It's your choice. But in that time, post World War II, there was this reframing that modern things were better than what was natural, right? So you started dumping pesticides on everything, right? And look, they made crops better for a bit, I will say, but then we had formula, which was life-saving for so many children. So I'm not saying, but then the messaging was, this is better than breast milk. Without any scientific research, any backup. And now modern pediatrics is like, absolutely not. Yeah. There's no way we can recreate breast milk in a fucking food factory. Yeah.
No.
And since then, the idea was being sold convenience.
Yes.
Fast food.
Yes.
TV dinners, microwaving things. Yeah, and that's where we started adding a lot of preservatives. That's when we had to mass produce this stuff. So the quality of the ingredients goes down for profit, and even now, I mean, I don't eat fast food too much, but like like, look, Taco Bell's fucking delicious,
I
even though it's
know.
horrible for you.
I'm gonna regret it for the next like 3 days, but it's
Absolutely.
awesome for the 10
And
days.
a couple of years ago, I go, hun, I don't want to cook. You don't want to cook. Let's get the kids a 12-pack of tacos. Now, I'm thinking 1994 prices when I would run there on my lunch break from high school, and a 12-pack of tacos was like $7.
Yeah, no, not anymore.
And 4 medium Sprites and a 12-pack of tacos was almost $50. And I was like, are you fucking kidding me? We could have gone to an actual Mexican restaurant and had real food.
Yeah.
You know? And that is what we've been sold. And I think that started with the boomers, right? They were told, they were marketed to in a way like, oh, taking care of kids is hard. Wouldn't you just rather throw a casserole of this prepackaged stuff in the oven and throw it right on the dinner table and everybody's good?
Yeah.
Or, hey, you don't want to miss your shows. Pull this out, put it on the TV tray.
Yeah. I mean that. Yes.
And they fell for it hook, line, and sinker because even the advertising changed, right? We saw this even with that previous, the silent generation. Their advertising was, this is the last pair of pants you'll need to buy. This sewing machine will last you a lifetime. The boomers were the ones that bought well, you want to be unique. Buy this vase.
Yeah.
Oh, this lamp. Buy this. And then you had to express your style. And there's nothing wrong with that. But selling, they started this throwaway culture, and they did that with the aspects that actually adjust life. I'm talking out my ass right now because I have this is not me. Like, I have an anthropology background and or anything like that, but these are trends that I see being talked about that are adjacent to health.
Yes.
That we don't even think about as health, but what you put in your body is so much more important than that one doctor's checkup.
Well, just like we talked about the decisions, shift in decisions that built the Leaning Tower of Pisa, like I say.
Yeah.
It's the same thing for your body, right? Every decision. And until you start to understand what's wiring those decisions, unwire them and wire them the way that feels right to you and listening to your body, you don't recognize how many of those patterns. And so I'm 100% with you that is a core fundamental of the health shift that we need to make. And I know that you hear and see it because your patients are coming in, and yes, you can do these things to support them. And if they continue to live by that wiring and put Taco Bell or McDonald's into their body for every meal, you can't change that. You can only shift the whole system if the whole system starts to shift, right? And I'm not saying you have to do it overnight. I'm not saying you can't, you shouldn't, because I think that's a toxic.
Oh, it's absolutely not easy either. And this is where food science starts to get a little dirty, where they're selling you combinations of things that are super addictive. And being that, we always talk about leaky gut and SIBO and these kind of things, those bacteria, those microbes in your, because it's not just bacteria, send signals to your brain. They hijack your gut, telling you, I need more sugar. And guess what? Well, everything that's coming out of a box is so laden with it. So it's not easy. And look, you're not a bad person if you can't get the scale to move. You're not I don't want, there's shame around it. There's those kind of things. And in this case, you have to do the work and it sucks. But in a lot of cases, man, you were set up.
Yeah.
It's not
some grace. You've got a lot to unwind and work through because society has not set us up for success.
No, for anything,
anywhere. It is an avalanche that you're trying to come out from underneath, and it is hard.
Yeah. Because the messaging is you got to eat right and you got to exercise and then you got to get 8 hours of sleep and you better be good in bed because you need a partner that's right. And you're like, I can't even I cry at the end of my workday. You know, like, that's it, right? There's no joy in your life. How the hell are you? Oh, my bank account's negative. What the fuck am I going to do? Yeah, I got to eat a fucking gourmet or completely organic meal.
Right.
And like, then you're blaming yourself, right? And look, yes,
Yeah.
control what you can control, but
Yeah.
the deck is stacked against you.
Yeah, it is. It's hard to unwind. And so
God, was this doom and gloom? I feel like I was too doom and gloom.
Okay, well, let's shift into
Okay.
what can we do, right? So like there are, and at the same time, all that we've been fed is that there's external solutions, right?
Yeah.
And why we can't accept that there are like readily available resources to us for free, meaning the earth, the sun, nature. That is something, but I would love to hear your thoughts on like, okay, the deck is stacked against us. It is hard. It is challenging. Maybe I can't afford to do the acupuncture every week like I really want to. Or the breathwork class or the yoga or the big gym or what are those things? Like, how can I start to chip away at this? Like,
So I think you're absolutely right. There's so many free resources, and we do a lot of things at my office. I do cold plunge, red light therapy, sauna, and salt therapy, and a lot of them. And I've joked about this. If people were spent a little bit more time outside, they wouldn't need a lot of this stuff, right? Yeah, and look, in the summer when it's hot out, okay, sweat. When it's cold, maybe get a little cold. Don't go, stay outside for an hour and a half with no clothes on. But within that, getting natural sunlight, not sitting out there and baking in the sun all day, but like early morning, those red light waves that come in those early morning hours or late afternoon hours, and letting them hit your body, letting them hit your skin. Meditation, I cannot say enough about meditation, right? It's part and parcel of East Asian medicine, but it's its own thing too, These things cost nothing. If you have an internet access, go on YouTube, vet the source, but in most cases, sitting down and taking a few deep breaths, you don't need a full breath work class. They're great. Take them if you can. But in that sense of community as well, you get out of that. But know that there's a lot of free resources out there that are really sound. Worry about the quality of the ingredients a little bit more. I have a friend that said eat closer to the ground, and what she meant is every time you have to pull it out of the ground and step it one further away from that, it's a little less good for you. I don't even think that's the right way to word that, but the more processed it is, the less you're getting out of it, right? So and then look, man, I've had, God, did I say look, man? Wow, that's super official there.
Your Gen X is totally fine.
but within that, there is this, like, is the thing, if you're going to eat something, if you're going to do something that isn't good for you, are you going to enjoy it? Because we don't quantify enjoyment, right? If you're like, I have to eat this every day and I hate it. Yeah. That's one, you're not going to stick with that. Yeah. Two, and I'm not saying like, oh, give yourself a little reward every day, but within that, like, look, man, I go out once a month and I hang out with friends. We have a good time. I'm going to drink a little. Okay. That's fine. Every night you have a problem. Yeah. So even that, but like, there's value in that camaraderie. There's value in eating a meal that isn't exactly the healthiest for you if you absolutely enjoy it.
Yeah.
Like, I'm still doing it at nearly 50 where I'm like, oh, I shouldn't have eaten that.
Yeah.
The next day, and I'm like, that's
it.
Yeah, that was you liked it at the time, but now you're paying for it. What's worse? The day after, or the the enjoyment, does that outweigh it? And then you start making decisions based on that. Yeah. But those are all free stuff. They're not sexy. They're not, like I said, going to be New York Times bestsellers.
I know, which is like the irony back to like all of the things that we've talked about, right? Of this, like, really being challenging to get people excited about the boring stuff.
Yeah, yeah, and and maybe it isn't even excitement. Maybe it's just acknowledgement of it,
Yeah.
and being able to go, okay, I can do this little bit, and that'll get me 80% of the way there.
Yeah. I mean, I think, just even if you take away like, oh, the red light waves are in the morning and the evening,
Yeah,
and I find a way to watch the sunset,
yeah.
win, win,
Yeah,
ticket,
and
right?
and then as a Gen Xer, I've got a lot of ennui as well, which I only ever first read that word and I was like, "What's a newie?" Uh, but yeah, staring at a sunset or a sunrise is a good way to combat that as well. I've just cured existentialism.
Oh my goodness. Oh my goodness. I am just, well, one, I'm just enjoying our conversation, loving this so much because it's so real and authentic. And I think at this moment in the world, that is gold and is at minimum where we need to keep correcting ourselves. Right? I don't know what the right word is, right? But right sizing ourselves into like, okay, authentic human, being human. I'm not perfecting. I'm not saying all the right things on a script that is going to hit the algorithm in all the way. I'm being a real human. I'm in connection. I'm enjoying life. I'm laughing. I'm having fun. And I'm doing the best to make the best decisions I can with the information I have right now.
Yeah,
And
yeah.
that feels like what our conversation has been all about, which is the deck is stacked against you. You're not wrong. You're not crazy. It's real. And do the best with every decision that you make every day. And that's
Absolutely.
all you can do. That's all you can, and enjoy it. Enjoy the ride because that counts. Like you said, the joy, I think we really underestimate joy as an important component of life. And we get so focused on doing the right things that we suck all the life out of it.
Yeah, it's hard, but yeah, that's it. Do the best you can and try and enjoy a little bit of it.
Yeah. Yeah. Okay. So is there anything you want to share with the audience or point them towards that's happening in your world right now?
So
I'll promote.
So I don't know if this is going to air in the next 15 days.
You might.
But my podcast, Irreverent Health, which please check that out. I say the F word a lot more there than I did here. I was good here. Is hosting a movie called Suck It Up, Buttercup, which is about medical burnout for both physicians and the patients, and a lot of stuff we touched on here about the system, and not just this concept of what they called what did he call it? Learned helplessness. What can we do as a community to fix it? So if you want, go to our website, check out Suck It Up Buttercup. You can Google that too. You can even stream that online. And then my clinic is charmcityintegrative.com. You can find out more about me there. You can find out about the services we offer. Please come see us if you're in Baltimore. If you're looking for my books, the Cupping book is a self-help, short little 130-page book on how to do cupping at home. That's the cover right there. And I just wanted to return a traditional home practice back to people's hands. And these little steps that you can do, and the cups, even the ones on the cover there, don't cost much. The book doesn't cost that much, and it's a tool you can learn and then share with your family like it was originally intended. And then I speak. I do a lot of podcasts and interviews. So just check my website for that.
Love it. Love it. And thank you for bringing the cupping in. I know we didn't get to all the topics that we thought about.
We had a good time. We had a good time.
Yeah, exactly. But I love that as another like entry point into things that you can do that aren't huge investments, but offer a lot of benefits. So thank you for sharing that resource.
Oh, no problem. No problem.
Absolutely. Well, thank you, Tom. This has been an amazing conversation.
I had so much fun. Thank you for having me.
Oh, you're so welcome. And to everybody, thank you for tuning in. We'll see you next time.